Hey everybody, Dr. Jeff Riggenbach here, award-winning author of the book, The Borderline Personality Disorder Toolbox, a practical evidence-based guide for regulating emotions. I've devoted the better part of the past 20 years of my life to working with clients with this diagnosis, and I'm here to tell you, contrary to popular belief, there is hope. These folks can get better, and a number of them do get significantly better when they receive the proper treatment, when they have the tools necessary to do so. During the 17-plus years that I developed and directed BPD-specific treatment programs in psychiatric hospital and outpatient clinic settings, specifically, we saw improvements in terms of decreased suicide attempts, in terms of decreased other types of self-injurious behavior, in terms of other types of decreased impulsive or what we may call self-destructive behaviors. We saw decreased hospitalizations. We saw decreased completed suicides. We saw decreased both frequency and intensity of mood swings. And in addition to all of those decreases of the bad stuff, we also saw some significant increases. Most importantly, I think just in terms of general overall quality of life. I'm so excited to tell you that I'm headed your direction to do a series of workshops in May of 2019 in a number of different Australian cities. I'm going to show you some of those very specific practical strategies, some of which are in the book, but many of which are not, that have been shown to be effective when working with this population. Specifically, we're going to get into how do you communicate with these folks in a way that, you don't accidentally sort of push one of their buttons and set them off. How do you communicate with them in a way that's effective? How to communicate with them in a way that decreases their defensiveness and doesn't cause you to feel like you have to kind of walk on eggshells. We're going to teach emotion regulation and distress tolerance skills. We're going to teach some cognitive strategies for sort of chipping into that black and white or that all or nothing thinking, so as to increase flexibility in thinking and promote effective problem solving, which can be very difficult for this population. I'm also going to give you some very specific symptom-targeted strategies that you can use to sort of put out fires in the moment, so to speak. Respond to them in that moment when they're in crisis. And finally, I know that not all of you have the ability to work with these folks on a long-term basis, but for practitioners that do, we're going to give you some schema-focused strategies, some schema modification tools, if you will, to really do that deeper work. So our symptom-focused strategies, symptom-targeted strategies are helpful for kind of putting out the fires in the moment, and then the schema-based, the deeper work is helpful for, sort of doing the fire prevention. And I don't know of anybody that would argue that it's not a good idea to both have a fire extinguisher so we can put fires out in the moment, but also to then do the fire prevention education to hopefully do what we can to prevent fires from occurring in the first place. And I can promise you I'm looking forward to teaching you skills in both of those categories. I hope you'll come join us when I'm down there in your neck of the woods. I can't wait to get down to Australia in May. In the meantime, be well.